Next up, we want to talk about one of the most important topics, or in fact, tools allowing us to better understand what is really happening in psychotherapy and mental health. The topic of our discussion is Mental Health Helpline, the issues we have addressed so far and what's next. Here to talk to you about it, Anna Malinowska, Learning and Development Manager at Ringier, Axel Springer, Polska. Hello, Anna.
Hello.
Hi. And we also have Tadeusz Reimus, CEO, psychotherapist at Mental Health Helpline. Hello, Tadeusz.
Hi, Łukasz. Hi, Anna. Hi, everyone.
It's such an important topic, and I'm sure both of you have a lot of interesting statistics to share, and we only have like 20 minutes or maybe a little less. Tell us what's happening in psychotherapy these days, if you look back at the past 365 days, preferably.
Well, I'm a psychotherapist, as you were saying, Łukasz, but I'm also like a man who is responsible for Mental Health Helpline, and we provide some safe and professional place for psychological support in a virtual space, and it's a secure, dedicated application. Yes. So, and Anya is a client of ours that I particularly admire, because when we started working together, I was so impressed that the Axel Springer is like mature, and it's this combination of strategic thinking and mental health, and it's good connection that is really important in media business. So I was thinking that this whole year was like roller coaster, and there were many new topics, and as a psychotherapist that have some 20 plus years of experience, I've seen really new topics. So for the
20
purpose
plus
of this
years.
meeting, yeah.
Tadeusz, sounds like you started in secondary school.
Well, thank you, but psychotherapy
it's really humble.
is when you're a psychotherapist, you are working the longest, and you living the maturest, the data. I can work with 90.
As always, Tadeusz, you sound very humble, but the fact remains that Mental Health Helpline is one of the biggest, if not the biggest, mental health helplines in Poland, if not CE.
Yeah, I'm surprised, but I'm really proud by that. Yes.
Tell us more about the stats, Tadeusz, because I think they sound really interesting. This shift from May onwards and towards December. What happened in your project?
Well, for the purpose of this conversation, I have prepared the data of the session topics. So if I can ask for a slide. Yeah, thank you so much. You can see this, that we have these three main topics on the consultation, and we have like 5,000 of the consultations. Of course, there are individual sessions that are not adapt to 100%, because in one session that can be like a lot of topics. But the three mains are the stress and mood and emotional regulation. The second is, as you can see, it's 75%. So it was the most common, this emotion regulation. Although it sounds like a complex psychological technique, it's like actually simple mental and behavioral process that many of us already do, consciously or unconsciously. For example, people take walks or listen to music, and actually when they are stressed or they're in conflicts, there is a huge impairment or difficulty to feel by yourself and in terms of emotional regulation. The second topic is occupational role work. It's 60%, the lowest start, but still very important. This role is so important that when you're speaking with a psychotherapist or psychologist or intervent, it's important that you can discuss with someone who can help you what is expected from you. So we have these topics about expectations in work. As you can see, perfectionism is the first category, like smaller category that is really common in our discussions. And the third, like interpersonal relations, well, it's self-explanatory. The more close we are connected to the people we love, the happier we feel and the more personal satisfaction we have in our lives. So most people like rate these moments as the most important life experiences. So occupational stuff and stress is not so important. But from the point of view of the mental health helpline, these are the barriers or the deficits that our clients or patients were discussing with the professionals. I think it's curious that it's this kind of percentage, and I think 1 year ago or 2 years ago the percentage would be pretty much different. For example, I would say that the occupational role would be much higher in this psychological framework.
Tadeusz, can you help us better understand perhaps how the trends in psychotherapy have been evolving? Because there was a strong shift towards the end of the year. Can you give us a couple of stats perhaps?
Well, I would say that the secret of mental health during pandemic times, it has less to do with our like extrinsic motivations such as money, rewards, personal gain, and more to do with intrinsic motivations. So in terms of data and stats, it's not so that I can just like put some numbers, because there are plenty of research that the meaningful relation we build and the ability to service to people who need it is the most important factor of your satisfaction. Actually, I would say that we are in the shift from the medical and the psychiatric paradigm to think about mental health to well-being and well-balanced during the everyday life. And it's huge because, in Poland, when you're mentally impaired or you have some kind of psychological problems, it would be taboo. You would go outside the society and all of the relation, and you would be silent about it when it would happen to you or to your family. And now, and
Absolutely.
It's one of the and I think it's one of the good conclusions from the pandemic, that the mental health now is for everyone. And I have some stats that before pandemic it was around 30% of the population having some mental health problems or crises, and now it's 50 and 60 and 70 even by some research. But the other thing is that it's really for a medical paradigm increase for the depression, for example, that it was diagnosed for a 5 to 8% of population. It depends if they have some kind of fear disorder, anxiety disorder. Now, and it's like WHO statistics, the depression is diagnosed 3 times more, 3 times. So you can assess that for 100% people, like 20 have some psychiatrically diagnosed symptoms of the depression, and it's severe illness for the staff. So
these numbers are so huge that they're almost unbelievable. Thank you for giving us this background, so to say, Tadeusz, because I've been waiting to ask Anna a question from perhaps a bit of a client perspective. Anna, when does it actually make sense to offer psychological support for employees? tell us in case of a company like yours?
In my opinion, we should be ready to bring such help all the time, because it increases productivity and motivation and improves company business efficiency. It reduced employee turnover and the number of sick leaves on account of mental health issues, and it also reduced stress. Statistics show that about 85% of employees in companies are stressed, and about
85%.
Yes, 85%. Yes, exactly. And about 30% suffer from mental disorders. And example, 32% of Poles say that their mental health has deteriorated, and more often they expect help from the legislator. Our task as an employer is also to build self-awareness, to pay attention to mental health issues, and to promote the idea of building mental resilience. And in my opinion, we must be aware of the fact that mental health comprises sleep, nutrition, and physical activity, among others, and we should try to provide employees with such a wide scope of activities. Thank you.
I couldn't
You're
agree
saying that
more.
32 Poles. I know research that, for example, in Canada, that it's about 50 that their mental health is deteriorated, and actually we do not know yet, because it is still happening, and we will see in terms of seeing patients, but also in certain groups of the population, for example, children or adolescents, the numbers are even higher, and we have such cases on mental health helpline that I am trying to do. I'm talking too much, I know.
You're almost unstoppable, Tadeusz, but I suppose it's the right thing to do in your field of work. Tell me, is there a seasonality effect, in the sense that do you get more work in December compared to July? Obviously you do.
Well, I would say yes 1 year ago, but now
1 year.
Yes, for example, we have had this hope at June that we will have less work because of the holidays. And well, all the team was saying, okay, now we can go for a holiday, for example. It appeared that actually the number of patients and clients increased. We were wondering why. And it turns out that it's not about pandemia, but it was about the voting in Poland, that it was increasingly like anxiety disorders. And actually with Anya and with our media clients, we're thinking that's the importance of the giving care for employees and for the families, because the factors are so huge. For example, the children will not go to school, so I don't know, 30-40% of parents should be supported. If you're taking care of the depression patient, you have to know that the symptoms are just like contagious, so you can be depressed. And the statistics in this year are just like totally out of the roof from the one side, and the seasonality that you're asking is not existing anymore. We are in the blind spot.
You covered a lot of interesting aspects to it. One is the infectious dimension to depression and mental disorders. Anna, can I come back to you for a while, because we've been talking about statistics, percentages, etc. But if we were to talk about the actual mental health ROI, how can one measure it, and how does it impact the organization.
And people with poor mental health miss on average 1 to 12 days a year and suffer about 50 days of reduced productivity. And the ROI issues, such as mental health programs, can be measured using the following metrics: absenteeism rate and causes of absenteeism, employee turnover, accident rate, and engagement. And we can also consider somatic symptoms, insomnia, functional disorders, symptoms of depression, professional burnout, and anxiety levels. And in 2020,
and a lot more from the medical point of view. But as far as I know, this is organizations' factors for return on investment. Yeah.
Yes, I agree. An example, in 2020, about 1.5 million sick leaves were issued on account of mental and behavioral disorders. A 25% increase compared to 2019, and as many as 28 million days of absenteeism were used due to mental health disorders. This is an increase of about 37% compared to 2019.
This is huge.
Very huge. This is very huge number.
Well, and I don't know if you mentioned that it's economically when you're asking for return on investment, it's economical factor. So I don't know if you were having this research. What's the return on investment actual degree? I don't remember if it's 1 to 3 or 1 to 4.
I don't remember too. Maybe 5 to 1.
Maybe 5 to 1. Yes,
maybe
because I know the different research and one of the largest number is that every $1, let's say, that is invested inside the organization can give, and it's actual return on investment factor to count $5 or $4. I don't know what's the research exact number, but I think the 5 is the biggest one that I know.
It's really important to talk about this topic, and I think we should definitely come back to it over a much longer time frame. We need more time to look into it. But for now, we have very little time. So Tadeusz, I'm going to ask you to do the Mission Impossible piece of our conversation, and that is to give us an overview of how the mental health helpline itself differs from other service providers. Less than 2 minutes to do the job. Enjoy.
It is Mission Impossible. A friend of mine who once shared that I considered a really eye-opening wisdom that it's a good description of mental health helpline. He said he is a psychiatrist. So he said, if I wouldn't invite someone into my house, I shouldn't let them into my head and into my heart. So this is the idea that I'm recruiting my team, that I will invite them to my house and to my head and to my heart. So that's the short version. And the longer one is that we have the selection of specific specialists. It's not an anonymous voice on the other end of the phone. It's not EAP when you need to have some, bystanders or
so essentially, you're very careful choosing the experts you work with. Is that what you're saying?
Yes. And the client and the employee has the direct line to them. They are choosing. Mm-hmm. They are choosing the names, and they can actually have the support in mental health from the beginning, from the diagnosis, because each one of my team has the clinical experience. So they know how to, for example, diagnose the suicidal thoughts from the attempts. They know how
I was hoping, Tadeusz, that at least towards the end of this conversation, we will come up with something at least slightly optimistic, which brings me to my last question to you. If you look at the trends in mental health, what are they? Mental health support, I mean, what are they, the key ones, and how does it relate to the job of managers?
I'm a psychotherapist as a first occupation, so my point of view is to support like human beings and people. But I think that as a manager, you have the responsibility to some extent to listen, to see what's going on with your employees, to support them. For example, to say about the options and to say without this taboo that, well, maybe you should see a professional, because I can see that not only the numbers are going low for your efficiency, but I'm worrying. I'm worried about you. So I will tell you the story. One patient of mine, we're just like on the session. She's the really high in hierarchy of one of the companies, and she has a diagnosed depression, and she wasn't in a good shape. After the session, she disappeared. And her husband were calling to the clinic. I was trying to get her by the phone. She wouldn't answer. She just left the car. And the one phone that she answered was that of her manager. No husband, no psychotherapist, no father, no mother. When her manager called, and he did amazing job that I think may saved her life, because he oriented when she was on the bridge, what he should do. He was just like,
this is what happened when I asked Tadeusz to tell me an optimistic story at the end of the conversation. Tadeusz,
it is an optimistic story. It is an optimistic
we've run
story.
Out of time. We've run
she
out
was
of time.
Saved and she was secure.
Good.
It is an optimistic story.
95% of this story by Tadeusz was hugely pessimistic, and then he gives us the light at the end of the tunnel.
But it is optimistic story, Łukasz, really.
I'm afraid we've already run out of time. I'm sorry for that, and I promise, Anna, next time the three of us speak, I'll do my best to keep Tadeusz quiet most of the conversation and leave all the space to you. Thank you. It's been an absolute pleasure to talk to you, and hopefully we'll have an opportunity to get deeper into this.
Thank you. It was an honor.
Thank you. All the best. Good luck.